active. Sometimes it can be seen down at its attachment here into the sternum, where you can actually see activity of it, and it may be different from side to side. We can also look at shoulder posture, and again this can sometimes be more apparent from the front, and as we can see here, we can see a little bit of asymmetry between side to side shoulder posture here, where this right shoulder looks a little bit more down and protracted. Again, we can look at the level, the sternum and the ribs, and look for any changes in the thoracic cage. And this might be very relevant with somebody who has got a chronic respiratory problem and thoracic spine pain. So things like a barrel chest or pigeon chest. And we can also look at the breathing pattern. Again, if somebody breathes through their apical areas, or whether they breathe down through their diaphragm. This may all indicate or be related to thoracic spine and cervical spine problems, particularly thoracic spine, because the joints of the thoracic spine must move during the breathing cycle. We can also look at abdominal tone. Again, looking at the upper and lower abdominals. And again, we can also look at the pectoral tone here and the shoulder tone. In assessment of the cervicothoracic region, it's important to clear any joints adjacent to this region. So in clearing the cervical spine, we would clear the shoulder joint. It's important to remember that the shoulder joint complex consists of 4 different articulations, so we have to consider there may be shoulder joint pathology there also. So we've got to consider the scapulothoracic joint, the glenohumeral joint, and the acromioclavicular and sternoclavicular joints anteriorly. And these may be implicated as we clear the shoulder joint movements. So the 2 movements we would use would be flexion, bring into full elevation. Again, we can add in a little bit of adduction also, and apply overpressure. Again, we are looking for the symptoms that the patient has reported on their subjective assessment. We also can use hand behind back. So again, bringing the arm into extension, adduction, and medial rotation. Again, just stabilizing the scapula and applying that overpressure. Again, we are looking for any reproduction of symptoms that the patient may complain of during the subjective assessment. If the patient also had pain referring down into the elbow, wrist or hand, we would also clear those joints. If the patient complained of thoracic symptoms, particularly in the low thoracic region, then it would be appropriate to clear the lumbar spine. So the first movement we're going to look at in the clearing test of the lumbar spine is flexion. So I'm going to ask Eric to turn around and to stand just nice, comfortable hip width apart. And I'm going to ask him to flex forward, running his hands down the front of his legs but keeping his knees straight and going as far as he can go. The decision to apply overpressure will be based on the subjective examination. Again, I'm looking for reproduction of his symptoms and at what point in the range they may occur. It's also worth noting if symptoms are reproduced on return from flexion, because that may be relevant. I can then move on to assessing side flexion. And again, I'm going to ask Eric to side flex to the right by running his right hand down his right leg, again keeping his knees straight. Again, I'll apply overpressure if irritability and severity is low. I can repeat to the left side. So again, running the hands down and again applying overpressure. If the patient had pain at rest or pain was reproduced early in movement, then I would not apply overpressure. For extension, I will ask Eric to stand in just beside the plinth. And we can use the plinth just as a block to ensure that there is no movement occurring from his hip joints to prevent any sway forward from this region. I'm going to ask him to put his hands across his chest. And I'm going to ask him to extend back from his lumbar spine, just giving him a little bit of guidance as we go. Again, I can overpress there if appropriate. The quadrants can also be used as clearing tests if irritability and severity is low. Again, we can start from the same position where I ask Eric to put his hands back over his trunk again. Again, I'm going to extend, side flex, and rotate. And again, I can apply overpressure in this position, and I can repeat to the opposite side. And these would be the standard clearing tests for the lumbar spine.
In the presence of wrist or hand pain, the elbow needs to be screened. And once again, active movement with overpressure can be used to do this. So Emily, can I get you to bend your hand up towards yourself? Any pain?
No.
And if I press in like this, any pain?
No.
And once again, if I get you to straighten your hand as much as you can, any problem?
No.
And if I press, any pain?
No.
Okay. The wrist may need to be screened in the presence of hand pain. And once again, active flexion. Can I get you to bend your hand down as far as you can? Any pain?
No.
With overpressure, any pain?
No.
And repeat that with extension. Bring your hand back as far as you can. Any pain? And overpressure, any pain? To screen for hand pain. This completes the screening examination.
So to assess cervical spine movement, we're going to just get Dave into a nice posture there. And we're going to look at his flexion. Again, with your own patient, you might decide to leave the most painful movement till last. So if from the subjective assessment they have reported that flexion positions is the worst for their pain, then leave that movement until the very end. So in looking at flexion, I'm going to ask Dave now to bring his chin down to his chest as if you're curling your chin in. And again, we're looking for the available range, going right down as far as you can, tucking that chin right in. Okay, and again, we are looking at the shape of the curve as he goes down. And you can see here it stays quite straight here. And again, you can often observe if there is any movement in the lower cervical region, or if there's too much movement in the lower cervical region versus the upper cervical region. Again, to apply overpressure, I'm going to place one hand on the occiput and one hand on the cervical thoracic junction area, and I'm going to apply that overpressure to get that end feel. That feels a little bit restricted there, but there should be a definite capsular end feel there. We would also observe as he comes back up from flexion about how he returns from flexion. So again, just going down again and coming back up, to see how does he initiate that return from flexion. Does he initiate with his lower cervical or upper cervical spine? We can also look at a general extension. So again, I'm going to ask you now to look up to the ceiling for me there, Dave. And again, this can be more difficult to see where exactly he's moving through the spine. But again, you can observe if there is changes in that curve or what is happening around that lower cervical area. And again, we can apply overpressure there if appropriate. Again, if the patient reported any symptoms such as dizziness, particularly extension and rotation, they may be a flag for vertebral artery testing, which will also be discussed later on. We're now going on to test side flexions. So this time I'm going to ask you to bring your left ear down to left shoulder for me. Okay, and again, in this position, we want to ensure that he doesn't combine movements, that he doesn't try to do combined side flexion rotation. So again, I want you just to bring the ear straight down and guide him, just to give him a little bit of direction if he doesn't quite get the movement the first time. And again, we want to look to see if that curve tends to change with the movement. And again, it stays quite straight through that mid-cervical spine here. And again, we can apply overpressure, like so. And remember, as we bring the spine into left side flexion, we are closing on that left side, but opening on that right side. So that's important to relate back to symptom response and the area of symptom response. And again, we can compare it to the right side. So again, side bending down, watching for the curve change, and watching that he doesn't try to compensate by either shrugging his shoulder up, which he may try to do if he has limited range, or by rotating at the same time, and that might be due to muscle tightness or some form of restriction. So again, applying that overpressure. Okay, we can then bring him back up and again look at rotation. So this time I'm going to ask you to turn your head to me, to the left. And again, we're going to look at his general range. Remember, rotation is quite a free movement in the cervical spine, so he should be getting to approximately 90 degrees here. Again, looking